Now, the Supreme Court has said that all stray dogs in Delhi NCR must be shifted away from residential localities, and any organization that blocks this exercise will face the strictest action. The top court's significant order comes amidst a rise in cases of dog bites in Delhi, leading to rabies deaths. NDTV, remember, has been running a campaign about the stray dog menace on the streets that has left children and elderly persons injured and in some cases even dead. Following the Supreme Court's order, the Delhi government has said that it will ensure its timely implementation. But is the removal of 10 lakh dogs from the Delhi streets really practical? That's what I ask on the show tonight. But first up, here's what happened today.
It started with a campaign. NDTV reporting every attack, every victim's ordeal, asking questions, seeking a fix to the stray dogs menace in the country. Now the Supreme Court has spoken, calling the stray dog menace a serious public safety concern. The apex court noted the need to round up stray dogs and directed the Municipal Corporation of Delhi to pick up the stray dogs and relocate them to other locality. The Supreme Court said that if any organization intervenes, they will face action. The court made it clear that it will hear government's side on this and that application by dog lovers will not be entertained.
Very thankful to NDTV to start this campaign regarding the stray dogs and see the result is come out. Today, I want to appreciate the Supreme Court order regarding the stray dogs. That is, all the stray dogs were shifted to the dog shelters within 8 weeks by the MCD. And it is a very big and the great news for all of us.
Between January and June this year, 49 rabies cases, 35,198 animal bite incidents reported in Delhi. From finding enough shelter place to ensuring proper care, the challenge ahead is immense. But the court has made it clear, delays will not be tolerated. The Municipal Corporation of Delhi has now formed a special committee to carry out the court's directive, balancing humane treatment with immediate removal from the streets.
एनडीटीवी को भी बधाई देना चाहता हूं, आपने जनता से जुड़ा हुआ मुद्दा उठाया है और ये जो आपका अभियान है इस विषय को सभी लोगों ने संज्ञान लिया था और आज कोर्ट का जो निर्णय है वो निर्णय मेरा ये मानना है कि दिल्ली सरकार जिस दिशा में आगे बढ़ रही थी पिछले कुछ समय से मुख्यमंत्री जी के नेतृत्व में, उसी दिशा में हमारे को और सरल करने का काम सुप्रीम कोर्ट का ये आदेश करेगा.
But not everyone is on board.
और फ्राइडे को ही तय हुआ था एक 14 पॉइंट प्रोग्राम चल जाएगा और उसमें 2 साल के अंदर अंदर सबको राहत मिलती. लेकिन अब ये जजमेंट आ गया. अब ये जजमेंट मुझे नहीं मालूम कि लीगल भी है कि नहीं, बस एक गुस्से में देने वाला, आप आओ बैठो रोब जमाओ जजमेंट दे दो और कहो कि कोई नहीं बोलेगा, कोई मुझे सुनना नहीं है.
With the deadline now in place, the stray dog crisis is finally seeing concrete orders from the top. NDTV will keep tracking whether this ruling stays on paper or clear the streets. With Nupur Dogra, Aarti Krishnan, Malvika Murali, Bureau Report, NDTV.
Joining us, she's an animal activist, rights activist. Dr. Tanmay Mahapatra is a public health expert. Sadhana, many are seeing this. Is this, displacement of dogs really a solution, and can that be achieved given the scale at which they are there everywhere?
Thank you for inviting me for the panel, Maria. I feel that the overall judgment from the Honorable Supreme Court is quite an impractical solution to the problem that we have in hand. When we are talking about dog attacks, we are already missing out the point that our population has increased. The population density in most of the cities is really high, and that is actually creating a lot of conflicts for animals. That is one thing. And the second thing is, if the emphasis is largely on the rabies death, then it means that the city and the municipality has failed in doing the vaccinations correctly. That is, every year anti-rabies vaccination has to happen for the 70% of the dog population that is there in the city. If such an activity is not being conducted, that is when you will start seeing so much of increase in rabies death. So ideally, our focus has to be on assessing what is the implementation rate of animal birth control program as well as animal anti-rabies vaccination program with Delhi, rather than thinking that we have a conflict and we will eliminate one of the species, corner them, put them somewhere without understanding the scientific and ecological impact of such a decision.
Dr. Tanmay, in several cities in various parts of the world, we do not have this kind of a menace. How have they managed? Have they done something similar, as the Supreme Court has ordered that relocate all 10 lakh dogs across Delhi NCR?
So, first of all, when the chief judiciary of a country takes such a decision, there must be some logic that we need to understand. Implementational gaps are everywhere. Even after this particular decision, implementation gaps will be there. To answer your question, there are certain operational issues which ultimately any implication of a policy gets kind of failed by. So things related to the ineffective animal birth control, no accurate monitoring through data, as well as inadequate infrastructure are the issues which ultimately end up in not managing the situation as other countries have managed. In countries where we don't have this kind of thing, we must be sure about the fact that the vaccination, all the other aspects related to the veterinary availability for infected dogs being treated, for things related to the adequate manpower and the community awareness regarding all these. Now, in absence of that, when we find out suddenly a situation when this country having about 62 million stray dogs per the pet homelessness index, as well as WHO data, World Health Organization data showing that in India, 92 to 97% of rabies deaths, human rabies deaths are being caused by dog bites, and among them 60% from stray dogs. It's a public health concern we have to think about. And our country is accounting for 36% of global rabies deaths. So there is a requirement of something. Let's think that this is the start of the process.
Yes, this is an emergency because India accounts for 36% of these deaths because, dog bites actually have an extremely high fatality rate and claim nearly 60,000 lives every year. And that is why, Sadhana, that is the only way out of this.
Not really, Maria. First of all, 36% is something that is being quoted for almost 10 years. But even today, if you go into Gram Panchayat level, they don't have records of literally anything. They are not even recording any dog bites. So I understand that there is a serious public health concern that is going on. But what is more important is to understand that if a simple program like ABC and ARV could not be implemented in India for 20 years, what are the chances that they are going to implement this dog shelter in an appropriate manner? That is one question. And the second question is, already there is no space in the city. Let us take the example of Bangalore, wherein we have been asking for additional ABC centers for almost 5 years. And the politicians and the government, they keep coming back by saying there is no land available. So if there is no land available to handle just 10,000 dogs in a month for sterilization in a circulation, then how is it that you are going to house 3 lakh dogs in Bangalore, 10 lakh dogs in Delhi? And at the same time, it is also very hypocritical to say that we are going to safeguard the urban population from the dog bites and we are going to dump all the dogs in the outskirts of the city, which is nothing but village and suburbs. Right. Ultimately, what we are telling is you cannot get rid of any species and then think you're safe, because being safe is something very debatable in our day.
No, but then if they are a public, public life hazard, there is a concern of this nature, then it has to be addressed. So that, Dr. Tanmay, you get the last word here. 30 seconds.
I
This is the
agree. I
way
just
forward
wanted
is
to tell
very
you
clear.
one thing, Maria.
But how, implementation challenges aside, do you think this will ensure that there is some kind of containment to this problem? Even if, of course, perhaps in months and years we learn how to tackle with it, but then at the moment this is the only way out.
Maria, I just wanted to add
One moment, ma'am.
point.
Let Tanmay finish, please. Dr. Tanmay.
So basically, it's definitely a containment at this point of time, but it's not time to debate. It's the time to solidarity. We need to actually ensure that all the non-government organizations and other civic bodies who work for the best of the animals, they need to join hands with the civil societies and the judiciary to ensure that putting them into some shelter is not the end of the solution. What next going to happen with them? What is the veterinary support for ensuring that those dogs in those shelters are kept with actual health, and ultimately going forward, how we take this towards the proper community awareness instead of getting into protest and other things. This is not putting them in the shelter is not the end of the solution. It's actually the start. I mentioned this before also. There is a requirement of having an overall plan, and definitely putting it from urban to rural is not at all something as a solution, and I don't think that is in the plan. So ultimately, I think it's the time to join hands to make it a complete comprehensive solution with proper implementation, including workforce, including infrastructure, including awareness, as well as ensuring animal
Okay, so Sadhna, you wanted 10 seconds quickly, please.
Maria, all I wanted to tell was containment is the right way to go, but then that is by simplifying ABC and making sure that we are able to sterilize more animals rather than putting them in a place where it's going to be territorial and contagious.
All right, Sadhna and Dr. Tanmay, really appreciate your time. Thank you so much for joining us on this broadcast.